Yes. So over the years, even nowadays, with families, so it'll be like the mom and dad, the caregivers of a young adult, a late teenager, 20, 25-year, 30-year-old adult child with schizophrenia. Their, I would say, most common response, the most common issue is frustration. Frustration with the medical care system. They might be a little bit angry. They could be asking God, why did this happen in my family? That sort of thing. And there is a bit of grief and grieving and mourning, you might say, because of the loss of the anticipated future for their family and for their young adult child, who now has been stricken, if you will, with this unusual condition called schizophrenia, because it can be very debilitating and sometimes bewildering. So there are a variety of reactions, and fear could be one of them if the young adult child with schizophrenia is getting, say, a bit paranoid, which is a form of the fixed false belief of psychosis called a delusion. So paranoia is one type of delusion. And maybe because they're all close with each other, maybe the young adult is afraid of the mom and dad, and maybe it starts having an adversarial reaction to them. So fear is a thing. Frustration with the medications. Maybe they don't get to see their psychiatrist enough, and usually the psychiatrist will prescribe medications, but then they need another person to do the talk therapy, counseling for the person. And then another frustration is that many times the young person with the psychotic symptoms, the beginning of schizophrenia, many times they don't think there's anything wrong with them. Yeah. So it's kind of a lack of awareness. And one of the audio podcasts, we were just talking about the Schizophrenia Care Project website and the podcast, one of them talks about that very phenomenon. And it has a fancy name from French neurologists in the 1800s, over a century ago. It's called anosognosia. And that fancy word means the person has an illness or a condition, but that person doesn't understand it. They don't believe they have it. So it really started with people that had a stroke, who then were denying that they'd had a stroke and can't use their arm anymore. And so in this case with schizophrenia, it's people that have these hallucinations and delusions and hearing voices and false beliefs and things like that, but they don't think they're sick. And that's really a strange condition that goes along with schizophrenia. I would say in my hospital life for 20 years, about a third of the people in acute care, maybe 25%, up to 30%, they didn't believe they had an illness.